Today, I will be presenting on an important aspect of an endodontic treatment, that is, root canal observation technique. As we know, the success of root canal therapy does not depend only on cleaning and shaping of the canals, but equally on how well we seal the root canal system. And the observation is a process of filling the cleaned and shaped root canal spaces with a biocompatible material in order to prevent reinfection and to create fluid-tight seal. This step plays a critical role in eliminating the pathways for microorganisms and ensuring the long-term success of the treatment. Of endodontics, observation is a method used to fill and seal the cleaned and shaped root canals using the root canal sealer and a core filling material. Rationale of observation is to entomb any residual microorganism, prevent coronal leakage of microorganism, and prevent percolation of periapical and periodontal fluids. In short, the rationale of observation is to create a hermetic seal that ensures the long-term success of root canal therapy and prevent treatment failure. The techniques of observation is collateral compaction, warm compaction, continuous wave compaction, thermoplasticized gutta percha injection, carrier-based gutta percha, simple fill sectional observation technique, max speed and thermomechanical compaction technique, and chemical plasticized gutta percha observation technique, and custom code observation technique. The collateral compaction technique is the most commonly practiced observation technique. The clinical considerations are sealer consideration. Sealer application on a canal wall can be performed using lentospiral or by using master cone itself. Spreader configuration. The size of spreader is determined by the width of a prepared canal and the lateral fit of the primary cone. Greater the space between the canal wall and the butt end of the gutta percha, the larger the spreader used. Master cone considerations. Selection of a master cone gutta percha should be similar to the master apical file size. Minimal judicious force should be used on the spreader during the compaction process in order to avoid the root fractures. So, to elaborate on techniques of collateral compaction, the picture A shows the root canal after the completion of cleaning and shaping. The picture B shows checking the fit of a spreader to be within 1 mm of working length, and the picture C shows the placement of a master cone. D shows the placement of spreader alongside of the master cone to a length of 1 mm short of the master cone to compact the apical part of the cone. From E to H, the lateral compaction of the additional cones are shown sequentially. Next we go to warm vertical compaction. The principle. The warm vertical condensation or warm gutta percha technique of filling the root canals was introduced by Schilder with the objective of filling the main root canal as well as the lateral and accessory canals. Using heater plugger, one applies pressure in a vertical direction to the heat softened gutta percha and thereby causes it to flow and to fill the entire lumen of the canal. The warm vertical compaction technique. Master cone is adopted in the prepared root canals, severing the coronal portion of a master cone with a heated instrument, compaction of the master cone, sequential segments removed with the heat carrier, followed by the compaction. Once the apical third is reached, the canal is backfilled with the heated segment of gutta percha, followed by the compaction with a suitable plugger. Warm lateral compaction. This technique provides the advantages inherent to the thermoplastic technique as well as length control during observation. This technique involves placement of master cone and lateral compaction using heat carrier such as Endotech 11 tip and Endo 20 tip. This device is placed besides the master cone and activated, followed by placement of unheated spreader in the space previously occupied by the heat carrier. Auxiliary cones are then placed and the process is repeated until the canal is filled. Continuous wave compaction. This principle is a variation of warm vertical compaction technique, employs the use of gutta percha cones and plugger that mimics a tapered preparation, thereby permitting the application of greater hydraulic force during warm compaction. Continuous wave compaction technique. After selecting an appropriate master cone, a plugger is pre-fitted to fit within 5 to 7 mm of working length. The thermoplastic backfill unit is set to 200 degrees Celsius and heated plugger is moved rapidly 1 to 2 seconds to within 3 mm of binding point. The heat is inactivated while firm pressure is maintained to the plugger for 5 to 10 seconds. After the GP has cooled, a 1 second application of heat separates the plugger from GP and it is removed. The remaining canal space is obturated using the thermoplastic injection technique. In carrier-based gutta percha technique, there are thermofill thermoplasticized technique, gutta core thermoplasticized technique, simple fill sectional obturation technique. Thermophil thermoplasticized technique. The pre-op radiograph of tooth 3-5 is taken. Pre-endodontic restoration done using composite resin. Radiographing show pre-endodontic restoration. Access opening performed through the restored tooth. ISO number 30K file placed to working length. Radiographic verification of file. Master file Pro Taper Universal F3 placed to working length. Radiographic verification of master file. Thermophil verifier number 30 placed to working length. Radiographic verification of thermophil verifier from left to right. ISO 2% file. Pro Taper F3 verifier stripped thermophil carrier. Of thermophil thermoplastic technique is that thermoprep press oven for heating thermophil carrier, drying the kennel using paper points, placement of AH plus sealer using 6% ISO 30 gutta percha cone, heated thermophil carrier is introduced into the kennel, thermophil carrier is placed to working length as verified by stopper placement, radiographic shown. A thermophil carrier is placed. Thermophil carrier handle sectioned at orifice level using high-speed carbonate burr. Selection of thermophil carrier at the orifice level and radiographic verifications of the sectioned thermophil carrier. The continuation of the thermophil thermoplastic technique is a 40% of phosphoric acid etchant is placed in corneal axis, etchant washed and dried, followed by placement of bonding agent, blue core composite placed at the orifice level, curing the layer of composite resin, completed composite coronal seal, and verification of completed obturation with an adequate coronal and the apical seal. The picture here shows the gutta cone obturator, simple fill sectional obturator system, and thermoprep 2 oven for heating carrier based obturators such as gutta cone. Mexperian thermomechanical compaction method. The compaction method includes by Mexperian uses heat to decrease the gutta percha viscosity and increase its plasticity. The heat is created by rotating a compacting instrument in a slow speed contra angle handpiece at 8000 to 10,000 rpm alongside gutta percha cone inside the root canal. The compacted whose spiral 90 flutes are similar to flutes on the headstone file but in reverse force the softened gutta percha apically and laterally. As a compacted blade breaks easily if it binds, this method should be used to fill straight kennel only. Using step back method, the kennel should be enlarged to at least the size of number 45 instrument. Gutta percha cones are inserted into the prepare kennel short of the apex. A compacted blade selected according to the width and length of the prepare kennel and is inserted between the gutta percha and the kennel wall. Until the stop on the compacted blade, rotating tip of the blade is guided to within 1.5 mm of root apex. Restrictions of the blade within the kennel prevents the forcing of thermoplasticized gutta percha through the root apex. The plastic gutta percha moves laterally and apically because of the reversed flutes on the compacted blade, pushing the softened gutta percha forward the sideways even when there is withdrawing of the rotating blade from the kennel. Chemically plasticized gutta percha technique. Gutta percha can be plasticized by chemical solvents such as chloroform, eucalyptol, xylol. The disadvantage of using chemical solvent filling material is inability to control the overflowing with the resultant periapical tissue reaction and shrinkage of filling after setting, resulting in a poor apical and lateral seal. Custom cone technique. Custom cone technique is a chairside procedure employed for customizing the gutta percha in wide kennels where traditional master cone cannot be adopted. The clinician has to customize the gutta percha points to achieve the tuck back. The technique. Soften an appropriate size gutta percha with one or more auxiliary cones with the help of heat and roll together between two glass slabs. A spatula may also be used as an alternative. A single master cone of increased diameter is created which is incised within the kennel. Soften the tip of master cone with a chloroform, eucalyptol and halothane for few seconds and gently place it to the working length with the lock-up plier. On removing the softened gutta percha carries the impression of a kennel. This process is repeated till the sunk fit is achieved. Ensure the gutta percha remains semi-rigid during the process. A radiograph is exposed to verify proper fit and the position before obturating the kennel with the custom cone along with an appropriate tooth kennel sealer. Thank you.